It was in early November of 1997 that a series of peculiar therapy sessions compelled a child psychologist in Maine to contact the authorities. It all started with one of his young patients, a boy who began to speak about an imaginary friend he called Mr. Smile. The boy described Mr. Smile as someone who was always grinning and made everything feel happy. The child explained that whenever Mr. Smile was around, his feelings of anger and sadness disappeared. Although the boy was being treated for severe emotional issues, he claimed that Mr. Smile's presence, typically at the foot of his bed, brought him calmness and safety. According to the boy, Mr. Smile didn't speak but smelled sweet, like candy floss. Initially, the psychologist considered this imaginary friend a harmless coping mechanism for the boy's troubled home life. That opinion began to shift when another patient, a 9-year-old girl, mentioned having an imaginary friend with the same name and characteristics. Then a 7-year-old boy spoke about Mr. Smile. Then a 12-year-old boy. Then an 11-year-old girl. Within weeks, close to 15 children under the psychologist's care had mentioned Mr. Smile during therapy sessions. At first, he dismissed the similarities as coincidental. After all, many children have imaginary friends, and Mr. Smile seemed generic enough. But as more children provided eerily consistent descriptions, he began to grow uneasy. He decided to probe further.